I was having some chronic pain. I was continuing to exercise, but it was like it was getting harder to do, like jogging and stuff like that, and even noticed a little bit of a limp. So it was becoming more difficult, and I was exploring all different kinds of options so that I could continue, to exercise. Harder and harder for me was getting up out of a crouched position, because the knees, I was told I had close to bone on bone in my right knee, which was injured from old football injuries in high school. And so, some damage there. And they said there was a little bit of, scarring tissue and stuff like that. But they said, you're probably going to need a knee replacement or some other kind of procedure. Well, I was told I would never run again. I went to an orthopedic sports medicine doc, and he said, I can give you a temporary measure, like, like a cortisone shot in the knee, which he did. Then it lasted 4 or 5 days for me, and then I noticed it was pretty much back to the way it was. But I really wanted to investigate other options, and I'd heard about stem cell procedures, and I did a lot of research before I decided to go that route, because when somebody tells me I can't do something, I want to see if I can first. Well, for me, it was a business decision. I'm very busy. I speak at a lot. I do a lot of keynote conferences and training around the country. If I had a knee replacement, my downtime would have been significant, and the cost probably would have been more overall than just to go through the stem cell procedures. For me, it was a no-brainer. I'm always a believer in cutting edges and new technology and just new advances, and I thought, wow, there's some real potential in this, not just now but certainly in the future. I was told it was a Wild West and you really need to do your homework out there, so I really did my research, and then kind of decided with Wisconsin Stem Cell and went with them. They were very thorough. They actually took x-rays that the orthopedic doc didn't take in positions of my knee. I noticed relief right away, but I think that was from the injection itself and the fluid in the knee. But then I started noticing a real difference after about 6 or 7 weeks, but it can take months, from what I understand, because it's growing new tissue. I've gotten my life back. Yeah, I'm able to run faster, and I go upstairs. I intentionally take stairs when I go somewhere to speak. Well, one of the things I've done is I have a lot of friends who are going through very similar kinds of things right now, and a lot of them are former aging athletes, or they work as first responders, and they really want in some ways to continue to have that quality of life and do the recreational things that they enjoy doing, plus do the job that they need to do, which can be very vigorous sometimes. They talk to me and ask me, how's it going, Greg? And I tell them, it's going great. I'd highly recommend it. It's really kind of backed up the clock.